Hello everyone. So today I'm going to discuss what plab 2 is all about in general. Just to give you a brief introduction of plab 2 to those who are just starting their preparation. So plab 2 is basically an OSCE exam. Now, if you have taken OSCEs during your medical school, then it's very similar to that. But if you have not taken any OSCEs during your undergraduate studies, still don't panic. It's really a very simple exam, and you'll get the hang of it when you started to prepare it. Okay, so um there are basically 16 stations on which you are asked to perform a task, and there are one or two rest stations. So basically there are 18 stations, and out of them, on 16 you will be doing something. Okay, one station is 8 minutes long. um and for each station there is a small cubicle room. So when the exam start, you will be standing in front of a small cubicle room. Outside the room, on the wall, a scenario is written on a piece of paper, and you are given 90 seconds to read that scenario. Now, don't panic, 90 seconds are more than enough to read the scenario and to generally plan what you are going to do inside the station. So, my advice for you is to remember three things when you are reading the scenario. Number one, your role. So, you are basically FY2. And number second, where you are. Whether you are in GP, you are in the emergency room, you are in the gynecology department, you are in the pediatric department. So the setting of the scenario, okay. And third one will be name of your patient. Okay, because if you memorize the name of your patient, it will be easier for you to refer him by his name throughout the consultation, which gives a very good impact and boost your communication skill score. Okay, so three things I want you to remember: your role, your setting, the place where you are, that is either ER, GP, etc. And third one is the name of your patient. Okay, once 90 seconds are complete, a bell will ring and it will ask you to enter the cubicle. Okay, so you will enter the cubicle. When you enter the cubicle, there are usually two people. One is an examiner and the other is simulator. We call them simulators because they are not real patients, they are just actors and they are simulating. Okay, so either there's a simulator or there is a mannequin, that is, a dummy on which you have to either perform an examination or have to carry out some procedure. All right, so there are usually two people, an examiner and a simulator, or sometimes there is just an examiner and there is a mannequin, which is a dummy on which you have to perform a procedure or you have to perform an examination. Okay, so once you enter the cubicle, you will first of all greet your examiner. You will say good morning or good evening, depending upon the timing of your exam, and you can just say hello. And you will then after greeting them, you will tell them your GMC number, your name, and your GMC number loudly and clearly. Okay, please don't rush through this, because if you rush through this and they don't get your GMC number or your name clearly, they will just have to stop you and ask you to repeat it, which will just waste your time. So once you are done with verbalizing your name and GMC number, you will then start your task. Okay, so the task might ask you to talk to a patient and to give initial management, which will mean that you will just take a history and then you will provide your management. Okay, at 6 minutes, another bell will ring, and this bell will tell you that you have 2 minutes remaining. So it will help you to finalize your task. Okay, so the whole exam basically lasts for 3 hours, and there are regarding stations. There are different type of stations. So there are either medicine stations or surgical stations, or there can be gynae patients, pediatric patients. There can be eye or ENT scenarios. Okay, or you have to perform a procedure on someone, not basically a person or but a mannequin, like passing IV cannulation, passing catheter, NG tube, etc. Sometime you will have to teach a student or teach a junior doctor or a nursing student. Okay, there are communication skill scenarios where you have to counsel a patient, and there are sometimes acute consultations like emergency situation. But in emergency situation, of course, you don't have a real person, but you have a sim, which is basically a dummy, and it is connected to a monitor, and the monitor gives you vital sign, and the dummy also talks to you. Okay, so when you ask him how are you feeling, so he responds. Basically the dummy is connected to a microphone, and some person is talking into it, but it's basically mimicking an emergency situation. Okay, So you have a mix of all these different type of stations, and the basically the passing score, it varies from day to day. Okay, so it will depend upon the people who are who are taking the exam on, on your exam day. So your score will be compared to the score of those people. So if all candidates perform very well, then the passing score is high on that day. Okay, so it can be, out of 16 session, the passing score can be 11 on some days, or it can be 12. But on some days where the candidates don't perform, very well, and the passing score is low, it can be 19 stations. No, sorry, it can be 9 stations, or it can be 10 stations. So this was all about general introduction of plab 2, and I wish you best of luck in your preparation.